Ask the expert now, and from Bronson Urology specialist, Dr. William Spencer joins us. Good morning, doctor.
Good morning, sir. How are you?
I am good. We're going to talk about LUTS and BPH. And I looked at this. I said, I have no idea what those things are. And well, I guess it's a good thing we've got you here to tell us. It's a lot of letters. What do they mean? LUTS,
We'll unravel
LUTS.
that. Really they stand for avoiding symptoms, urinary symptoms, and we'll focus on men's side of it today. And really, they're some of the most common symptoms and problems men have above age 40 to 50. So the LUTS is an umbrella term for all these urinary symptoms men get. It stands for lower urinary tract symptoms, kind of a newer term in urology. So it encompasses all the various causes and relates to all the symptoms. BPH specifically means benign prostate hyperplasia or overgrowth, and we use that term alone for decades. So BPH is one cause of LUTS symptoms. So LUTS is a more useful term overall.
I see. So, what do you do for somebody with BPH?
Well, first, we have to look at what their symptoms are, and the history tells a lot. So I'll just go through briefly the symptoms, but men might complain of a weak stream or getting up excessively at night or urgent feelings they got to run to the bathroom, disrupt their work or social schedule, a whole host of symptoms, even leading to infections. And once every year or so, a man might literally back up his kidneys and go into kidney failure from blockage. There's a scoring system we use, a little indicator that men would rate their symptoms, how much it bothers them, and we can't forget that getting up a lot at night can actually disrupt the whole household. So other family members can be bothered. So we look at the symptoms and then the causes, and if we just look at the prostate overgrowth, that's one aspect, kind of like a cork in the bottle as the urine's going through there. But there are a lot of other causes, including use of caffeine and evening fluids and diuretics. One interesting thing we're looking at the last number of years is sleep apnea. A lot of men are snoring or stopping breathing, and if they get evaluated and get a CPAP machine, a lot of times that nighttime urination goes away. And finally, we look at make sure we look for prostate cancer with PSA and other neurologic causes, diabetes or Parkinson's or prior stroke. Neurologic factors can affect the bladder. So, like in all of medicine, the history tells an awful lot. We do our PSA testing and so forth. But to get to your question of treatment, sometimes just evaluating and talking to the patient, they're reassured and they don't really want any treatment. Then we can get into behavioral items where maybe they'll cut their evening fluids or cut their caffeine intake, maybe get sleep testing. So that's kind of the first tier.
And then what are there medications then if it leads that far?
Absolutely. When I started in training in the late 80s, there were no pills for prostate overgrowth, and all it was surgery. But absolutely millions of men take alpha blockers, Flomax or Rapaflo or Uroxetrol. They relax the prostate, helps about 70% of men. Another category are called 5-alpha reductase inhibitors, and like Proscar, Avodart, they slowly shrink the prostate. And a lot of men will be on both of those categories. And thirdly, there are pills to relax the bladder, anticholinergics, Detrol or Ditropan, others. And some men could actually end up on all three. They all have some low-grade side effects, so we have a long talk about those, and we kind of will go 1, 2, or 3. There are some over-the-counter preparations over the decades that haven't been subjected to a lot of rigorous study. Saw palmetto is one. So those are marginal, and they haven't been studied that well. But certainly we offer the medications as a next tier.
And then finally, if that's not producing the result desired, there's an option of surgery.
Right, and surgery, sounds daunting, like we're heading to the hospital and operating room and all those. Which certainly for decades, the classical TURP, the carving out, served us well. You go in the channel, carve it open, and that still is the best way to open up the most tissue. But we've had a whole litany of procedures, and some even in the office. So the goals would be that you could get off the medication, you open up the prostate, if that's the underlying cause, And I'll tell the patients kind of a baseball analogy. If you hit a home run, you fix all those symptoms. But sometimes we'll hit a double or a triple, and we'll fix a lot of the symptoms and improve their quality of life. One of the interesting newer procedures is just a very, very brief office procedure called Urolift, where we put little strings inside the prostate and kind of pull it open a bit, and a very low-stress office procedure the last few years. So we have long talks about all of these procedures and what are the potential short- and long-term benefits and risks. So that's kind of the third tier would be the procedures/surgeries, yes.
I'm thinking, Dr. Spencer, maybe one of the biggest mistakes men make is they go in to see their doctor at their regular visit and they keep some of this stuff to themselves.
Sure, and ladies have their bladder issues, and there's kind of a bashfulness, or some patients will say, "Oh, I didn't think we could do anything about it." Another thing is that the symptoms can develop so slowly that they almost learn to adapt with it, just cope. I'll have been getting up 5 times a night, and I'll say, "Well, does it bother you?" And I'll say, "No, not really. I just go back to sleep." Well, they wouldn't have tolerated that when they were 30 years old. So just subtle changes over time. So there are a lot of factors, and then we have to peel that away and look at why is it happening and how can we improve their life. Sleep is important. I read a whole book on the importance of sleep last year, a great little tome called Why We Sleep, and it's so important. And if one's getting up a lot at night, you're not getting a good night's sleep. It's detrimental to health, right?
Right, and those guys that say it's no problem to get up 5 times a night, I'm wagering they don't have 3 dogs. And because you
Right.
alluded
Well,
to that earlier, that could be a quality of life issue for everybody else in the house, too.
oh yeah, yes, exactly.
What should we do, Dr. Spencer, if we have some more questions?
Well, first off would be to talk to your primary doctor and actually as time goes by, just take a piece of paper and write down the symptoms as they occur to you, and then chat with them. And again, there are some very serious underlying causes we always want to think about for prostate cancer and diabetes. Check the urine for sugar. So just write all the ideas and symptoms. Go talk with your primary provider, and then we'd be happy to see patients as urologists and take it to the next step.
Dr. William Spencer, urologist at Bronson Urology Specialist. They're on Capitol Avenue here in Battle Creek. Thanks so much for joining us today.
My pleasure. Thank you.